If you suffer from chronic back or sciatica pain, there is a minimally invasive spinal fusion alternative. It is a medical breakthrough, and you are about to see the procedure being done by Dr. Wendy Lundquist here at Active Life Physical Medicine and Pain Center in Surprise. This is revolutionary. Tell us about this procedure and why is it done?
Yes, it is really exciting. It's a natural way to heal the body's discs. Let's liken it to Fix-A-Flat for the disc. The disc actually can tear and leak from the inside out, and that causes inflammation and irritation on nerves that go down your leg like sciatica. Well, what we need to do is create a way that's natural to seal that off. And what this does is take natural substances from the body called fibrin. This fibrin actually heals the disc, similarly to like how you get a cut. You get a cut and a scab forms and it heals over time. We can do the same thing utilizing fibrin sealant inside the disc, and the disc eventually will heal. We utilize some regenerative product inside the disc, and so over time you can have almost a brand new disc.
That's amazing. And it's called Discseel. That's the name of it. Walk us through how the procedure is done.
Yeah, so Discseel procedure is very minimally invasive. We use an X-ray machine and the patient lays down and we isolate where the disc problem is, and a needle goes inside of the disc. We put a little contrast. The contrast shows where the leakiness of the disc is, and we're able to identify that and know which discs are the problem. And then we put the fibrin sealant, also known as Discseel, inside the spinal discs, and that seals it off immediately, actually. Wow. And then we put regenerative type product, PRP or A2M plasma, or sometimes amniotic fluid, bone marrow, in the actual inside part of the disc. So over time, just like your cut would heal, over time it heals.
That's amazing. This is not surgery. This is not a back surgery. For a lot of folks who are watching, who's a good candidate for this treatment?
Yeah, so actually anyone that really wants to improve their pain and function and has a spinal disc problem is a good candidate. Most of the people are really good candidates. There are some diabetics and people who are on blood thinners and smokers, quit smoking, and that will help your healing capacity. But everyone does actually benefit from this if we truly know it's a disc problem, which disc problems are really, really common.
Right.
Yeah.
And you are one of only a handful of doctors performing Discseel.
Yes, so there's only 14 of us in the United States that were given the authority or delegation to do this procedure. Dr. Paza was the founder and did all the research and all that was necessary to find out that this really works. So now we're able to perform this and give an opportunity for patients to have an option to spinal surgery.
A wonderful alternative. Do they share that with you?
Yes, absolutely. And they come back much better, and no risk of scar tissue, chronic pain from the hardware, all the other issues that come along with a very invasive surgery.
Right, right. So I'm sure they're thanking you in many ways because they can get back to life a little bit.
Absolutely.
All right, Dr. Lundquist, thank you so much. And if you'd like to learn more about the Discseel procedure, here's the contact information and a special offer. Let's start off with that special offer. Get $1,000 off the Discseel procedure. Active Life Physical Medicine and Pain Center, they have 2 locations for your convenience. There's an office in Surprise and one in Litchfield Park. To book an appointment, call 623-535-9777 or visit activelifepaincenter.com.